when we come to the ground level, at the reality level, there we will face, for example, this uh, the other problems like HIPAA, then came the other problems. Nowadays, people are talking about AMR. When we talk about AMR, then we clearly understand that if you want to really address that issues beyond beyond the infectious diseases also, that needs a really a strong collaboration among the partners, among animal health, among human health, among the wildlife also as well. So people are, as because they are facing more and more problems, that also a push to bring them together. That look, gentlemen, we have to work together. We need not to work in silos. For example, for rabies cases, from 1948, WHO and WHO is doing some sort of partnership or something like that. But nowadays, people understand that the disease should be stopped at the source. For example, anthrax cases in Bangladesh, as Professor Rahman has mentioned, if you cannot stop the disease at the source, how can you protect the public health? That's very critical. Or another example is if there is some infectious disease in the domestic animal, that can even threaten the endangered species very quickly, which is a treasure for the globe. So it's really if you can have a very good advocacy, and that should be continuous one. So we have a set of advocacy, we stop there, probably that will not work. We have to do that one with that advocacy and creating some example that it has benefited the people out of one health approach. For example, if a team goes out together and then they give the advice, they conduct a vaccination program in the animals and the people are protected from anthrax, that will give a very good evidence that the One Health works very well.
As on today, we organized 8 conferences on One Health, starting from 2008 to 2015. The last conference we organized in Dhaka, that was in 2015 March. So we have been doing these things regularly, and the new conference will be organized in September this year. So this is about the annual conferences. In 2012, we organized a One Health training program with the support of FAO, and that involved people from all 3 disciplines, from animal health, from wildlife health, and from public health, to this training program intensively, including the human health, animal health, and environmental health. Following to that one, we had a very good support from the Messi University to develop a cohort of people to train in One Health or master degree course. And it continued for 2 cohorts that was supported by European Union and also by World Bank. So this is about Messi University initiative. Another initiative from the CDC that has been mentioned by Professor Mahmoud Rahman, FETPPB, which is not only epidemiology training program for public health, recently started to include veterinarian sector. And the latest one is the Chittagong Veterinary and Animal Science University has created a One Health Institute. They call it One Health Institute. And they are now preparing themselves to organize a formal training courses, short-term, long-term courses on One Health. So this is about the capacity building on this thing. Also, we are encouraging to undertake One Health research. So, for example, at the moment we have a very multi-institutional research project supported by DFID and British Biotechnology and Social Science Research Council. We call it GEL. GEL means zoonotic disease in emerging livestock system, and that is on poultry as a broad approach, how the poultry is playing a role in terms of disseminating zoonotic diseases. And that involves the Chittagong Veterinary Animal Science University, IDCR, FAO, Department of Livestock Service, and Bangladesh Livestock Research Institute, and Royal Veterinary College, London, and London School of Tropical Medicine and Hygiene. So this is a very multi-sectoral research approach. Similar research programs are also being supported by the government and other organizations. So training program, conferences, seminar, One Health Bangladesh regularly organize One Health talk, to share any experience. Training program in the from the donor agencies as well as from the overseas universities and IDCR and CDC. So altogether, this is a approach that we are really focusing with a lot of emphasis. Yes, I would support the later one. Different disciplines, but bringing people with different background to work under one health and how to collaborate. What are the common skills that we can use in collaboration? What are the special skills that we need to work in harmony with different group of people? These are the special focuses on One Health training program, particularly how do we work to interface.
Yeah, this is the way probably we are also thinking. If you look into the new department on health secretary, this is also bringing the people from the two disciplines together. So in that case also we are planning. This is a new entity. So in that case we are also planning that these people know how to coordinate, how to collaborate among themselves, how to have this institutional capacity building issues. Then we are planning this type of thing. Also the last point that that when we started with Egon together, that was a single business one. So nowadays we have to deal with multi-hectares. In that case, we have to train the people in a way so that they can deal with the multi-hectares, not only a single business or something.
Yes, so I can tell you that to make a One Health approach successful, I think you have to make three approaches. This is our experience. We want to share with other part of the world. One, you need a champion, and they should come from the government, champion institution. And say, for example, in Bangladesh, we have those champions, and government must be actively involved with this. Second message, very clear. The civil society movement is very important. Say, for example, we are doing One Health Bangladesh, and I think it helps to influence government. It helps the society to build society awareness. It helps to address any crisis issue in a stronger way. Sometimes it cannot be possible within the government system. And thirdly, we need also strong advocacy with the intergovernmental agencies like FAO, WHO, other organizations, donor agencies, because they are the partners for many activities in our community. So, if individually they work, sometimes we may not get the benefit. When they work together under one umbrella, in the one approach, we get maximum benefit. And that's why we say as a whole of the government approach, whole of the society approach, and also a global health approach. These three things should go together to make One Health successful. For our small meetings and other things, our members, we have 400 members, we get some money from them, we use those money. For big events like conferences, we get money from our partners. And partners covers from government, non-government, intergovernmental agencies, and donor agencies. They put together, and we always make the conference a partnership conference, one health conference of all the partners. And when we take any training program, say for example, it is the donor-driven or government-driven training program. The funding coming there, we are just working as a catalyzer, supporting them, mobilizing resource people from the company. The money is being used from a particular donors, maybe FAO, maybe WHO, maybe CDC, maybe government. So we do not handle much money. Our money is basically very limited, only for day-to-day small meetings, and that are based on membership fees. Yeah. Well, from Bangladesh, our message is very clear. Bangladesh desperately needs one health electricity. Why? It's a very densely populated country. It has huge animal population. It is recognized to be a hotspot for EIDs. Its environment is very vulnerable. So, we recognize that it is a one health approach that can keep our population healthy and thriving. It can also contribute to keep our environment better. It also can contribute to keep our animal health better. So our message is working together is the best way forward for better health of all species.
Yeah, this is from Bangladesh perspective. It's the message is the civil society on one hand that is complementary to the government efforts to protect the people of Bangladesh and beyond the global health, this environmental health, animal health, and the public health. And if you want to achieve and if you want to sustain, in that case, we have to develop the culture of working together. And if we can develop the culture of working together, that will be most important thing is that as because we are working for a long in silos, there are some mistrust and the others. And if we can work together, then it will be trust will be built, and we can complement each other and protect the people, protect the animal, and protect the environment.